Only me, responsible for caring for a whole patient for the whole shift. You're trusting me with that responsibility. That's how I felt when I got my first nursing job. The first month was brutal. So here are 5 things that I want new nurses and nursing students to always look out for when you're caring for patients. Being able to spot things like this as a new nurse, even as a nursing student, will honestly help to build your critical thinking skills when caring for patients. Number 1, your patient becomes suddenly agitated or confused. Like you were alert and oriented times 4 a couple minutes ago. Think of things like sepsis, hypoxia, even a stroke. Make sure that you assess and get to the root of what might be causing that disorientation. Number 2, your patient's respiratory rate is consistently sitting above 20. Tachypnea. Essentially, the patient is working harder to breathe. There has to be a reason why. Assess the patient completely before things get even worse. Number 3, pale or clammy skin. This is an issue with perfusion. Now the body is starting to direct blood to the vital organs, so you need to assess further, especially when this is a new or developing finding, as opposed to patients who have conditions like COPD or anemia. Number 4, the urine output drops less than 30 mLs per hour. Kidneys are trying to tell you something. So they're the first ones that give you that ring alert that something might be going on. They've dropped the urine output. It's your turn now to assess why. When the urine output starts to drop, you might start to see some concerning changes in the blood pressure and perfusion, so you need to act immediately. And finally, number 5, and one that I cannot overemphasize, your patient tells you that they feel something is wrong. I get it. You've had experience with patients who say something is wrong and nothing is actually wrong. Just remember, patients know their bodies more than you do. So when a patient suddenly starts telling you something is wrong, I need you to start listening. Honestly, you need to investigate and give them the reassurance if it's not something that requires an intervention. So when in doubt, believe the patient. Patients will tell you things before any monitors that you rely on will. Help them to investigate and assess and come to good interventions that can help save your patient's life. These are 5 things that I feel like every nursing student and every new nurse should kind of keep in the back of their minds as they go and begin to take care of patients. Have you ever noticed any of this during your clinical rotations? For our experienced nurses in the house, are there any things you feel like nursing students should know? So put it down in the comments. Let's talk about it. Share this with a nursing student or a new nurse, and I'll see you in the next video. Bye-bye.